Good afternoon, class. So today we will be covering chapters 13 and 14 on the peripheral nervous system and the autonomic nervous system. All right, so let's continue with some terminology. All right, so the peripheral nervous system essentially it's going to be the nerves and ganglia outside the central nervous system. So remember, the central nervous system is the brain and spinal cord. So the nerves, the cranial nerves that come off of the brain stem, okay, those cranial nerves, and also the spinal nerves, okay, are going to be a part of the peripheral nervous system. So a nerve equals a bundle of neuron fibers, and neuron fibers are bundled by connective tissue. If you notice, the terminology is very similar as far as the connective tissue from the muscle chapter. Now we're on the peripheral nervous system, but endoneurium is going to be the connective tissue that surrounds each fiber. A group of fibers are going to be bound into fascicles by the perineurium group of fibers. All right, bound into fascicles, and then fascicles are bound together by the epineurium. Okay, epineurium. And again, that terminology is very similar to the muscle connective tissue that we studied previously. All right, so classification of nerves. You could have mixed nerves that contain both sensory and motor fibers. You can have only sensory nerves, and notice that term afferent. Okay, those are going to carry impulses toward the central nervous system, and then you can have motor nerves efferent. Okay, they're going to carry impulses away from the central nervous system. Okay, to a muscle or gland. All right, so you have 12 pairs of cranial nerves, okay? So most serve the head and neck area. Only the pair of vagus nerves extend to the thoracic and abdominal cavities. Most are mixed nerves, but 3 are sensory only. Cranial nerves 1, 2, and 8. Okay, cranial nerves 1, 2, and 8 are sensory only. And this is a figure, all right, that shows you the cranial nerves, okay? And on the next slide, we're going to talk about which area each cranial nerve serves. Okay, all right, so there are several mnemonics for remembering the order of the cranial nerves. A lot of times, these mnemonics will work for you. Other times, maybe come up with your own mnemonic. But here are like 3 right here. So you should know these cranial nerves. You should know the order also. That's what the mnemonics help you remember. But you see this one, O, to touch and feel very green vegetables. So, and then this one, on occasion, trusty truck acts funny, very good vehicle anyhow. And then this one too down there, if I can move. On old Olympus, towering top, a Finn in German view some hops. So all 3 of those mnemonics go through cranial nerves from 1 to 12, okay? And they go in order. So that's the purpose of the mnemonic, and you should know these. You should know the order of the cranial nerves. All right, so cranial nerve 1 is the olfactory nerve, and that's a sensory for smell. Cranial nerve 2 is the optic nerve, sensory for vision. Cranial nerve 3 oculomotor nerve. That's the motor fibers to the eye muscles. And cranial nerve 4, trochlear motor fiber to one eye muscle. Cranial nerve 5 is trigeminal nerve, sensory for the face, motor fibers to chewing muscles. Cranial nerve 6, abducens nerve, motor fibers to eye muscles. Cranial nerve 7, facial nerve, sensory for taste, motor fibers to the face. And cranial nerve 8, vestibulocochlear nerve, which has sensory for balance and hearing. Glossopharyngeal nerve, cranial nerve 9, sensory for taste, motor fibers to the pharynx. Vagus nerve, cranial nerve 10, sensory and motor fibers for the pharynx, larynx, and viscera. Cranial nerve 11, accessory nerve, motor fibers to neck and upper back. And cranial nerve 12, hypoglossal nerve, motor fibers to tongue. So this is just a schematic showing you the cranial nerves on the brain and where they go too far as either sensory or motor to certain muscles. All right. So, or if it's for pure sensory, it showed you the sensory that it does. So that's what this diagram is doing. So you can take your time and trace each of the cranial nerves. All right, so the spinal nerves. So there is a pair of spinal nerves at the level of each vertebrae for a total of 31 pairs. So you have 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 1 coccygeal, formed by the combination of the ventral and dorsal roots of the spinal cord, and they're named for the region from which they arise, supply all parts of the body except the head, and the cranial nerves are going to supply the head. All right, so you can see right here, the figure, you can see the spinal cord, and then you can see the spinal nerves coming off of the spinal curve. So you see right here. So on this figure, you see terminology, plexus, so cervical plexus, brachial plexus. So essentially, if you look at the figure, a nerve plexus is a branching network of intersecting nerves. So essentially, a nerve plexus is composed of afferent and efferent fibers that arise from the merging of the interior rami of spinal nerves and blood vessels. So you see these branching network, okay, of intersecting nerves. Those are plexus, okay. These are plexus. All right. And then you see, remember, cauda equina. So remember the spinal cord ends at around L1, lumbar vertebrae 1. So after about L1, you're going to have the cauda equina, which is just the root endings of the nerves. And it kind of looks like a horse tail, what the name came from. You also see the cervical and lumbar enlargements of the spinal cord, which result from the enlargement of the gray matter that contains the neural machinery necessary to operate the limbs. All right, so those are the enlargement, cervical and lumbar enlargements. It's just an enlargement of gray matter. All right. All right. So if you remember, the plexus is a branching network of intersecting nerves, and they're going to form from the ventral rami. Okay. So this is just showing you. So for the cervical plexus, the ventral rami form cervical plexus C1 to C5. All right. For the brachial plexus, the ventral rami form brachial plexus. Okay, this is the brachial plexus formed from the ventral rami. No plexus formed in this intercostal nerve area T1 to T12, and then you have the ventral rami form the lumbar plexus L1 through L4. And then the ventral rami form the sacral plexus. Okay. All right. So spinal nerve divides soon after leaving the spinal cord. So essentially, as soon as they leave the spinal cord, they're going to divide into dorsal and ventral. They call it rami. All right. So ramus is the branch of a spinal nerve that contains both motor and sensory. And so you have your dorsal rami serve the skin and muscles of the posterior trunk. And then you have your ventral rami form a complex of networks, the plexus, for the interior. Okay, your ventral rami are going to form your plexus for the interior. And you also may remember from our terminology, dorsal means back, ventral is going to refer to the front. Okay, so that also give you some direction. And the next slide, you'll see an image of what's going on. So you see, this is the spinal cord, and then this is the spinal nerve coming off of the spinal cord, and you see the dorsal root ganglion right there. And remember, the dorsal root ganglion is a cluster of cell bodies, and the dorsal root of a spinal nerve, and essentially the dorsal root ganglia is going to contain cell bodies for sensory nerves that carry sensory information to the spinal cord. And then you see this spinal nerve is going to split. This is the split dorsal ramus and the ventral ramus. So you see right here, the dorsal ramus, okay, if you remember from the previous slide, okay, it's going to serve the skin and muscles of the posterior trunk, so the back, okay, the skin and muscles of the back of the posterior trunk. And remember, the ramus or the rami is going to have, it's going to be a branch of the spinal nerve, so it branches that contains both motor and sensory fibers. So the dorsal rami is going to serve the back, the muscles of the back, and the skin of the back. And then the ventral rami is where you form your plexus, okay? And then here go the ventral ramus, and you see it's forming a plexus. And the ventral ramus is going to also serve the ventral trunk, or the front, okay, the front of the trunk and the limbs. Okay, the ventral ramus is going to serve the front of the ventral trunk and the limbs. Okay. All right. Here's some more terminology we've been talking about already. The plexus is a network of nerves serving motor and sensory needs of the limbs. So your plexus are going to always form from the ventral rami, and again, it's going to serve the pretty much the ventral, the front part of the body and the limbs. Okay, and the dorsal rami, it serves the back, your back muscles and then your back skin. Those are the dorsal rami. The ventral rami is going to serve the front area of the body, okay, and the limbs. And you have your plexus in the four plexus: cervical, brachial, lumbar, and sacral regions. All right, so your cervical plexus originates from ventral rami and C1 through C5. So an important nerve in this area is the phrenic nerve, and the phrenic nerve is going to serve the diaphragm. So remember, the diaphragm muscle is important for your lung exchange. Okay, for breathing in when it contracts, and then pushing the air out, helps push the air out of your lungs. So for gas exchange, diaphragm is important. And then also the phrenic nerve innervates the shoulder and neck area. All right, so the brachial plexus originates from the ventral rami in C5 through C8 and T1. Important nerves are the axillary, radial, ulnar. So remember, anything in red is always important. Not that the other material isn't important, but always pay special attention to things in red. And then you also have the median and the musculocutaneous nerves. So the areas that these nerves serve are your shoulder, arm, forearm, and hand. And this is just showing you where these nerves are located. Axillary nerve right here, radial nerve, okay, right here, musculocutaneous nerve right here, ulnar nerve right here, radial nerve superficial branch right there, and the median nerve right there. All right, so again, they're in red, so it's important. All right, the lumbar plexus originates from ventral rami in L1 through L4. Important nerves in this area are the femoral and the obturator nerves. So areas that these nerves serve are the lower abdomen and the anterior and medial thighs. And this is showing you where you can find the femoral nerve. Okay. Here's the obturator nerve right there. All right, the sacral plexus originates from ventral rami in L4 through L5 and S1 through S4. important nerve, sciatic nerve, and the superior and inferior gluteal. Sciatic nerve gets a lot of notoriety. If you have lower back pain, it's usually due to the sciatic nerve. Area served, lower trunk and posterior thigh, lateral and posterior leg and foot, gluteal muscles of hip area. And the sciatic nerve is in red. And this is where you see the location of the sciatic nerve. Sciatic nerve is a really big nerve. And you see where it runs. And then here are the superior gluteal and inferior gluteal nerves. All right, so the peripheral nervous system, so nerves extending from the brain and spinal cord. So you have your spinal nerves, all right, carry impulses to and from the spinal cord, and your cranial nerves carry impulses to and from the brain. So the function of the peripheral nervous system is it serves as the communication lines among sensory organs, the brain, the spinal cord, and glands or muscles. So just understand that the peripheral nervous system and the central nervous system, they work together. It's not like um, they do separate tasks. Think of it as an extension. Really, the peripheral nervous system is really an extension of the central nervous system. Okay, and it's through the spinal and cranial nerves. Those are the extensions. Okay, so this is just a schematic showing you how things relate. So you have your central nervous system, your brain and spinal cord, and then you have your peripheral nervous system, which are the cranial and spinal nerves coming off of the brain and spinal cord. All right, and you see information's coming from your sensory organs, okay, afferent sensory information going to the peripheral nervous system, then continuing to the central nervous system. And then central nervous system integrates it, it processes the information, and it decides what to do, and it sends out an efferent motor signal to the peripheral nervous system. And then the peripheral nervous system is going to continue the motor efferent either to somatic skeletal muscles or autonomic smooth muscles or cardiac muscles and glands. Okay, and then in the autonomic nervous system, you remember you had the parasympathetic and the sympathetic nervous system. So if you remember from a previous lecture, the sympathetic part of the autonomic nervous system deals with the fight or flight, and then the parasympathetic, okay, it pretty much calms everything down. Sometimes the parasympathetic is referred to as the rest and digest system. It calms down everything after, you may have the danger or the fight and flight or gone. The parasympathetic is going to restore everything back to the rest and digest functions. All right, so remember, sensory is always going to be in the afferent, and that's carrying information to the central nervous system. And the motor is always the efferent, and it's the nerve fibers that carry impulses away from the central nervous system, and it's going to be toward a muscle or gland. Okay, that's the efferent. All right, so the motor efferent division, two subdivisions. Somatic, remember, somatic deals with your skeletal muscles. Okay, skeletal muscles, and it's consciously controlled. The autonomic nervous system is involuntary. All right, and it relates to the smooth muscles and cardiac muscles and glands. All right, and then your autonomic nervous system further divided into sympathetic, fight or flight, and parasympathetic, rest and digest nervous systems. Okay, so again, this is just showing you um, that after the sensory information comes in, goes from the peripheral to the central nervous system, it gets integrated, and then it goes from the central nervous system back to the peripheral, then to the motor efferent division, and then the efferent division can either go to either skeletal muscle or smooth muscle and cardiac muscle, which are the autonomic nervous system. All right, and then within the autonomic nervous system, you have your fight or flight sympathetic division and your rest and digest parasympathetic division. All right, so your somatic and autonomic nervous system. So the two systems differ in their effectors. So afferent pathways and their neurotransmitters, and the target organ responses to neurotransmitters. Okay. So the effectors in the somatic nervous system is going to be skeletal muscle. The effectors in the autonomic nervous system are going to be either cardiac muscle, smooth muscle, or glands. All right. All right, so this table summarizes the differences between somatic and autonomic nervous systems. So, with the somatic nervous system, you see the nerves. So you have one neuron, or it originates in the central nervous system, and the axons extend to the skeletal muscle served. So the effector organs are going to always be skeletal muscle, no subdivisions, and the neurotransmitter is acetylcholine. All right, so remember when we talked about muscles, pretty much the only neurotransmitter we mentioned was acetylcholine. All right, the autonomic nervous system. So it's two neuron systems consisting of preganglionic and postganglionic neurons. So you see on the next slide, but essentially a ganglion is essentially a cluster of nerve cell bodies. So, and you'll see on the next slide, you're going to have a synapses. So you're going to have a ganglion, which is a collection of nerve cell bodies. You're going to have a synapses pre-ganglionic, then you're going to have a post-ganglionic. Let me just show you the image. It's easier to understand. You see the image. So here's a ganglion. Here's a collection of nerve cell bodies. And you see this is pre-ganglionic right here. Pre means before the ganglion. Okay. And then this is going to be post-ganglionic. Okay. After the ganglion. So that's all that refers to. All right. So you're going to have nerves that are pre-ganglionic, nerves before the ganglion is pre-ganglionic, and then the nerves post-ganglionic, the nerve after the ganglion, okay? And the effector organ is going to be smooth muscle, cardiac muscle, and glands, and then the subdivisions are sympathetic and parasympathetic, and then you have more variety as far as the neurotransmitter. You have acetylcholine, epinephrine, and norepinephrine, okay? All right, so here's just another figure that you can visualize. You see the somatic, you have one neuron. So it goes from the central nervous system to the effector organ, which is the skeletal muscle. Okay, and you see acetylcholine. With the autonomic nervous system, you have sympathetic and parasympathetic. Okay, and then you see right here, you have your key for the sympathetic. This is the preganglionic axon, and then you have a post ganglionic axon. So here's the preganglionic axon, okay, and this, the neurotransmitter for that is acetylcholine. Then you have your postganglionic axon, and then you see the neurotransmitter at the end of this one is norepinephrine, and then you see the organs, effector organs, smooth muscles, in the stomach, so forth. They also, you have another sympathetic. This is one is dealing with the adrenal medulla, um, and you see that um, the synapse in the adrenal medulla is acetylcholine is in the synapse, and then when you're dealing with the in this case blood vessels in the blood, you're gonna have epinephrine and norepinephrine, okay, released, and it's gonna affect glands. All right, and then you have the parasympathetic division, and this is the ganglionic axon right here. You see acetylcholine in the synapse, and then the postganglionic axon. Also, you see acetylcholine, and you see cardiac muscle is the effector organ. All right, so this is the same figure that we've already discussed. All right, so the autonomic nervous system consists of motor neurons that innervate, smooth, cardiac muscles and glands, make adjustments to ensure optimal support for body activities, and operate via subconscious control. So remember, the autonomic nervous system is involuntary. All right, so the motor subdivision of the peripheral nervous system consists only of motor nerves, also known as the involuntary nervous system. Um, Regulates activities of cardiac and smooth muscles and glands, and two subdivisions, sympathetic division and parasympathetic division. So again, we're talking now about the autonomic nervous system. All right, so sympathetic, fight or flight, respond to unusual stimulus, takes over to increase activities. Remember, as the E division, exercise, excitement, emergency, and embarrassment. All right, so the role of the sympathetic division is to mobilize the body during activity. All right, it's the fight or flight system, promotes adjustments during exercise or when threatened. Blood flow is shunt to skeletal muscles and heart. The bronchioles dilate, liver releases glucose. All right, so the anatomy of the sympathetic division. So you have your preganglionic neurons originate from T1 through L2. Ganglia are at the sympathetic trunk near the spinal cord. Remember, ganglia just a collection of um, neuron cell bodies, and you have a short preganglionic neuron and a long postganglionic neuron transmits impulse from the central nervous system to the effector. And the neurotransmitters are norepinephrine and epinephrine. And those neurotransmitters are going to be released at the effector organs. All right, so the parasympathetic is of the division of the autonomic nervous system is the housekeeping activities, conserves energy, also refers to as rest and digest. Okay, maintains daily necessary body functions. Remember as the D division: digestion, defecation, and diuresis. All right, so the role of the parasympathetic division promotes maintenance activities and conserves body energy. Its activity is illustrated in a person who relaxes, reading after a meal, blood pressure, heart rate, and respiratory rates are low, gastrointestinal tract activity is high, pupils are constricted, and lenses are accommodated for close vision. All right, so the anatomy of the parasympathetic division, the preganglionic neurons originate from the craniosacral regions. All right, so the cranial nerves 3, 7, 9, and 10. Okay, so the pretty much cranial region and then the sacral region, S2 through S4 region of the spinal cord. All right, due to the site preganglionic neurons originating the parasympathetic division, also known as the craniosacral division. Terminal ganglia are at the effector organs, and the neurotransmitter is acetylcholine. All right, so this is the same figure we got through talking about already. All right, so this is just showing you the effector organs that the parasympathetic and sympathetic nervous system serve. So remember, when you think of parasympathetic, think of craniosacral area. So essentially, the head and the very bottom sacral region. Okay, think of the parasympathetic. Okay, and then the sympathetic is everything pretty much in between the head and the very bottom. Okay. Um. All right. So here's a summary table. So you have your two divisions, sympathetic and parasympathetic. Origin of the fibers for the parasympathetic, remember, brain and sacral spinal cord. So cranial sacral region, the brain, and the sacral region of the spinal cord. For the sympathetic, it's the thorax lumbar region. Okay. Um, and then the length of the fibers for the parasympathetic, they're long, preganglionic, and a short post. And the sympathetic is the reverse, short, pre-ganglionic, and long post-ganglionic fibers. And then the location of the ganglia, which is collection of cell nerve bodies for the parasympathetic, is in the visceral effector organs, and the sympathetic is close to the spinal cord. And this is a good summary slide. All right, so conclusion, peripheral nervous system functions, serves as a communication lines among sensory organs, the brain, the spinal cord, and glands or muscles. The autonomic nervous system functions innervates smooth and cardiac muscles and glands, make adjustments to ensure optimal support for body activities, and operates via subconscious control. And two subdivisions of the autonomic nervous system: sympathetic um, division, which is your fight or flight, and parasympathetic, which is your rest and digest. All right, division. All right, so, and also just remember the neurotransmitters for the sympathetic division. It uses norepinephrine and epinephrine, whereas the parasympathetic division, it only uses acetylcholine. All right, that's the only neurotransmitter the parasympathetic nervous system uses. All right, that is the end of the lecture.